Picture someone who has been smoking for more than 50 years. I think of my Uncle Roger. His yellow-tinged fingertips and his raspy voice and this oxygen tank he carried around with him everywhere. That chronic cough, that's what we think of when we think of a lifelong smoker, that smoker's cough. Because we all know that smoking is horrible for your lungs. But what about the rest of the body? Like the heart?
Cutting back on smoking reduces every sort of complication for every disease that can occur to a patient. The risk of lung cancer, heart disease, lung disease, peripheral vascular disease, blockages in the legs. So many things are dramatically impacted by cutting back and hopefully stopping smoking. From a cardiac point of view, the primary risk is the atherosclerosis, the blockages that occur within the coronary arteries, the arteries that feed the heart. So everybody knows blood pressure, diabetes, and smoking and family history. All these things play a role, but smoking is actually the biggest role of all.
People who smoke have a huge risk of developing coronary heart disease, and cigarette smokers have it worse than those who smoke cigars or pipes. This is probably because cigar and pipe smokers are less likely to inhale, so not as much toxin makes its way into the body. Yes, toxins. That's not an exaggeration to scare you. There are actually thousands of toxins in all types of tobacco, but one of the main culprits for the heart damage is nicotine.
Now, why nicotine does this is not completely understood. It certainly acts as an irritant to the walls of the inside of the blood vessels. Just like high blood pressure is an irritant, diabetes, the high sugar, irritates the walls. But smoking irritates the walls more than anything. And that irritation causes the bad cholesterol to start depositing on the walls. The bad is the LDL cholesterol. So that LDL bad cholesterol starts depositing at the areas of the wall that are injured or irritated from the nicotine and tar that's within the cigarettes. And certainly lowering cholesterol helps, but it does not eliminate it by any way, shape, or form. Does not eliminate, so one should not think, well, I'm taking a cholesterol pill and a blood pressure pill, so it's fine for me to continue smoking. The smoking is the biggest risk of all.
Even smokers who don't inhale are subject to the effects of nicotine, which wiggles its way into your bloodstream via the small blood vessels of the soft tissues in your mouth and mucous membranes. If you do inhale, the nicotine has an even greater and quicker way into the blood. Your lungs are lined by alveoli, tiny air sacs where your body normally exchanges oxygen for carbon dioxide. That exchange is the perfect time for nicotine to slip into the bloodstream by hitching a ride on oxygen's back. From there it goes to other parts of the body, irritating the blood vessels along the way. Well, even if my Uncle Roger knew all this, and he probably did, he would have just scoffed and said, "Well, I've been smoking for 50 years, it's no use stopping now." It's an attitude a lot of longtime smokers have, but they're wrong.
So when we talk about quitting smoking, any time is good. The younger the better, the sooner you stop the better. But one can say, listen, I've been smoking for 20 years or 40 years, leave me alone. What more can I do? The damage is done. But the data is clear there as well. Within 1 year, 50% less heart attacks. So when we quit smoking, it doesn't take long for the risk to start coming down. The risk may never come down to zero. The more years away from smoking, the lower the risk. Some studies have suggested within 7 to 10 years of smoking, even if it's been 20 years beforehand, your risk starts getting close to the general population. But the data with secondhand smoking, I like to quote all the time because it's so dramatic. 1 year, not even you smoking, your roommate quitting smoking, 50% lower risk for anybody in the environment just within a year. So there's no rationale to say, well, I've been smoking so many years, the damage is done, it's hopeless. That is not true at all. Within 1 year, just avoiding secondhand smoke, half as many heart attacks, and within 7 years or so, maybe 10 years, and somebody who's quit smoking, the risk starts getting close to the general population.
When you decide to quit, your cardiovascular system immediately starts to recover. In just 20 minutes, your blood pressure decreases. In 24 hours, your heart attack risk decreases. And in just 1 year, your risk of coronary heart disease is 50% less than what it was when you were smoking. So, as hard as it is to snuff out that last cigarette, it's a lot easier than trying to live with a dead heart. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Put out that cigarette.